Hi, I'm Micah Sutton, pastor here at McCord Road Christian Church, and I'm joined by Dr. Jim Bassett. We are here to talk about the coronavirus and the outbreak that we're seeing around the world, and to give a little bit more information and a little bit of clarity. The media is talking about it nonstop, and you're reading about it everywhere. And so we're just wanting to come to some understanding of what is the coronavirus, how do we protect ourselves from the coronavirus, what dangers are actually there, and what's real and what's hype. And that's kind of our goal here today. Now, our goal is not to give individual medical advice. If you're feeling ill or you're trying to figure out what's going on with you, don't rely on this interview to figure out a prescription or what's going on in your world. Seek medical help from your family doctor. But Dr. Jim, thank you for being here. And thank you for joining us and for lending your expertise to what's going on in the world right now.
Thank you.
So we've heard a lot about the virus, and so can you just kind of give us a synopsis of what the coronavirus is and maybe even what it isn't?
Well, coronavirus is a family of viruses. It causes a range of illnesses, anywhere from the common cold to serious respiratory illnesses. The COVID-19 is the one that we're all concerned about. Mm-hmm. However, there's been other, even more serious coronaviruses. Many are familiar with SARS from 2002 and MERS from 2012, both much more virulent than the coronavirus or COVID-19.
That's interesting because while I'm hearing coronavirus, and I've heard of SARS, I've heard of MERS, I never put the two together as being anywhere close to what we're seeing right now.
Yeah, they're all thought to have an animal host, but obviously have been transmitted to humans. Again, the SARS and corona were thought to come from bats, and MERS was thought to come from a camel.
It's one of the reasons why we've kept camels out of the Christmas play here at McCord. We're just trying to be safe. So what could we compare the coronavirus to that we would be more generally familiar with?
Well, what we usually experience is influenza A and B.
Right.
And comparing the two, certainly the coronavirus is more virulent than influenza. However, to date, there's approximately been 90,000 cases worldwide and 3,000 deaths from coronavirus.
Okay.
Influenza typically causes 32 million cases just alone in the United States and 18,000 deaths a year.
Wow. But obviously there seems to be a greater fear or a greater response to coronavirus. We don't hear this about the flu on a regular basis, and so why would that be?
Well, again, it is more virulent than the influenza virus, and I think much of the problem is a lot of these questions are unanswered at this point.
Sure.
We do have antiviral medications that we can use for influenza. We don't have anything available for the coronavirus. There's no vaccines for the coronavirus, and there is for influenza. So I think therein lies some of the concerns.
And anytime something new is coming on the scene, it automatically raises the level of concern that we all feel. But the numbers bear out that, generally speaking, you have a greater chance of having complications with influenza, which we are familiar with, than we do coronavirus, which we are still yet not completely familiar with?
Well, certainly the percentage of risk, if you have the virus, you're more likely to have a serious illness. Currently, it's approximately 20% of people will experience severe illness with the coronavirus, as opposed to approximately 5% with the influenza.
Okay.
However, we have no cases in Ohio. And so you're much more likely to have influenza and have serious illness with influenza than coronavirus at this time.
So what can we do to protect ourselves, protect our loved ones? What can we do?
Well, the CDC just recommends a few common sense ideas.
Okay.
First, avoid people who are sick.
Okay.
They recommend at least 6 foot distance between someone. If you're going to the doctor's office, for example, and you're sitting in the waiting room, probably get 6 foot from other patients.
The waiting room in the doctor's offices that I visit, people are always trying to get as far away as possible, just anyway. So that makes sense.
We want to wash our hands, and just using soap and water is sufficient. They recommend at least 20 seconds for washing your hands. You can use hand sanitizers. They recommend hand sanitizers with at least 60% alcohol. We want to avoid touching our eyes, nose, and mouth after we've touched other objects.
Okay.
And finally, you just want to sanitize objects that have been touched or surfaces that have been touched by others. That's just kind of common sense things.
One of the things we're doing here at McCord, and I give kudos to our plant management and facilities people, is all the doorknobs, all of the light switches, and so on and so forth are consistently being cleaned, even throughout a Sunday morning. And throughout all of our services, people are going around and wiping those things down. And I really give them kudos, because I didn't think about it, but that was what was happening here on Sunday. Just a level of precaution. What about people who are traveling? I'm just in a conversation today with some folks who are going to be traveling to different parts of the United States, not overseas specifically, but what are some things that they can do to protect themselves?
Well, again, all the things that the CDC recommended, and again, the virus is thought to be spread by water droplets.
In the airplane, we're going to stay 6 feet away from the person in that seat right here.
Maybe not in the airplane.
Okay.
I will tell you that obviously there's been a shortage of masks to wear. The CDC does not believe they're helpful in preventing you acquiring the infection. If the person is infected, it's helpful in preventing its spread. But wearing a mask in the airport or airplane is probably not helpful. Again, it is spread by water droplets. That's someone sneezing or coughing. So I would try to avoid that. Again, if you shake a hand, touch a surface, again, remember not to bring your hand to your face, nose, or mouth. And you want to wash your hands as soon as possible or use a hand sanitizer.
What questions should we be asking that maybe the average person who isn't a physician may not know to ask or to look out for, to be careful about?
Well, the people who are most susceptible are the elderly and people with comorbid conditions. The average age of serious illness is 60,
okay.
and the average age of death is 80 with the coronavirus. So those people are more susceptible, and they just need to be more consistent with those recommendations.
Now, you said you used the term comorbid. What does that mean?
Someone that maybe has diabetes or immunosuppression, someone with heart disease, those people with other medical illnesses.
Okay, so a generally healthy individual should, while no one wants to get ill, no one wants to have a problem, a generally healthy individual should be able to deal with the coronavirus fairly successfully.
Much lower risk of serious illness.
That is spoken like a true doctor. I was thinking that before we started talking, and I can't remember if you said it during the filming here, but there aren't at this point no reported cases in Ohio?
Correct.
Okay, that is a blessing. Well, the scripture tells us that we are to be as wise as serpents and harmless as doves. So it's not good for us to put our heads in the sand and act like nothing's happening. But the Bible also tells us that we are not given the spirit of fear. And so we as believers are not going to respond in fear to what's going on in the world. Now, the media is hyping everything, and there is caution needed. There is awareness that's needed. But we're not operating in the spirit of fear. We know that God is in control. We know that he takes care of his people. We know we can trust him. And he's given us good sense. And you've just given us some really practical, good sense things that we can do to reduce our risk. And so I just encourage you. I encourage you to walk in that. Don't freak out. Allow God to cover you. And I pray that this information is benefiting you. Is there anything that we're missing, Dr. Bassett?
No, if people have questions, I would call their primary care physician. They can always call the health department. I don't know where they're doing testing. Initially, only the CDC was doing testing,
Okay.
but there are regional testing centers now.
Okay. Well, God bless you. And we're praying and believing that God's keeping you and your family safe, and that he's going to continue to keep our nation safe. We're praying for all those who are affected by coronavirus. We're praying for our doctors and our nurses and all those in the medical fields that are working to find a vaccine for this virus. And we believe that those things are coming forward. I do encourage us to pray for those who are in government facilities and so on and so forth that are trying to help push this thing forward. This is not political. This is an issue of health and safety for the people of our nation. And so I just encourage you in that today. God bless you. Thank you for watching, and I pray that it's been a benefit to you.